Good afternoon, everyone, and welcome to the Friday Wellness Webinar. We're glad you're all coming in. We're going to take a few minutes here while people start to come into the meeting. I'm going to share my screen. Hope you all are doing well today on this Friday. We're super excited about today's speaker. Just getting my Zoom share screen here. Go. All right, so I'm really excited to have our speaker today on the AIHM Wellness Webinar. Dr. Jaclyn Chasse-Smeaton will be here discussing strengthening the clinical connection, expert and very simple use of diagnostic testing in the integrative medicine practice. So for those of you joining us for the first time, the Academy of Integrative Health and Medicine is a global interprofessional Integrative Health Association working to transform healthcare, body, mind, spirit, community, and planet. And I do want to let people know that if you are just learning about us and are interested in our fellowship, we have an Integrative Health and Medicine Fellowship, and you can use this code and let us know that you came and heard Dr. Jaclyn Chasse-Smeaton speak. And you can get $1,500 off your tuition if you mention this wellness webinar. So today it's really a pleasure to have Dr. Jaclyn back with us. It's been a few months now, but she is here from Emerson Ecologics and Wellevate by Emerson. She's the VP of Medical Education for Emerson Ecologics. She served as the president of the American Association of Naturopathic Physicians and the New Hampshire Association of Naturopathic Doctors. And she served on the boards of the Integrative Healthcare Policy Consortium and the American Herbal Products Association. She's a clinician and just a really amazing leader and colleague. So Jaclyn, welcome. And I'm really excited to hear your presentation today.
Thanks so much, Tabitha. And also you didn't mention, but I'm an AIHM fellow myself.
That's true. That's
for the fellowship program. I'm in my second semester of the program, and it's fantastic. So I can definitely speak to the fact of how wonderful that is.
Thank you.
So I'm going to go ahead and share my screen now. And I haven't been this excited to talk about something in quite a long time, which is Wellevate Labs. So this went live about a week ago. And really, this comes out of me begging and pleading for us to find a solution to the diagnostic lab situation in integrative medicine. Because if anyone, and I'd love to you guys to put in the chat so we can see, if you use labs right now in practice, what labs are you utilizing and how are you doing it? Because if you're utilizing LabCorp or Quest or kind of conventional lab testing, there's a lot of good channels to do that through electronic ordering and things like that. But if you're using functional lab testing, you probably have experienced the same thing I did in the clinic, which is that you have different tests that you love from different individual companies. And in order to use those, you have to establish relationships with all the labs and manage all those relationships and manage multiple portals and retrieve results from different portals and stock kits in your office. And it just is very time consuming, filling out requisition forms and all that stuff. So today I'm going to talk about how you can utilize diagnostic labs in your practice, both conventional and functional, and why that's so important clinically. And I'm going to share a couple case studies with you. And then I'm going to get the pleasure of sharing with you a little bit about Wellevate Labs, which streamlined and simplified the labs process for you. It's free to use. There's no upcharge. There's no charge to your patient or to you as a practitioner. We at Wellevate are just very committed to making sure that we make practice as wonderful and as easy as possible for you. And I think you'll be pretty happy with how we've simplified the labs process. So without further ado, let's go ahead and dive in. So You're going to learn about Wellevate labs. We're going to talk about expanded testing. So maybe you are a clinician who's newer to integrative medicine and you extensively use conventional labs in the way that you were trained to, but you're thinking about how can you branch out and get more information clinically about a patient and functionally through the use of specialized testing. We're going to talk about that as well. We'll talk about some barriers that patients sometimes have with lab testing and how you might be able to overcome them. And then I'm going to share some case studies from myself and from our medical team at Emerson. Actually, each of us have submitted a study. 3 of us submitted a study, myself around hormones, another doc, Eric Nelson, around nutrients, and then Meredith Murray with GI and how she treats IBS, because that's an area where functional lab testing can add so much to a complicated picture and really removing the kind of the nondescript understanding of IBS for patients. I had one patient tell me the only part of the IBS diagnosis I believe I have is the BF part. There's got to be something underlying. We just have to figure out what it is. So let's go ahead and dive in. So, one thing I want to set the stage in is like medicine is absolutely changing. I know that if you're here, it's because you know this and you believe this, but where we used to have these evidence-based approaches where you had an evidence-based treatment option, when the patient reports the symptoms, you match them to the diagnosis, give them the right prescription, follow up and see, did it work? If it did, they're discharged. If it didn't, you go on to the next one. That kind of evidence-based, but very linear kind of disease-based medicine is really going by the wayside and being replaced with much more personalized treatment options. So here we collect the patient's symptoms. You might run conventional labs to get a diagnosis, but even if you can't find a true diagnosis, or even if you do, what we're doing differently is looking at underlying cause. Now, my treatment field is fertility. My whole clinical approach, I'm dedicated to treating infertility. And you can have, 10 different couples come in with the same diagnosis of infertility and have 10 very different causes, even low sperm count. There can be many, many causes for that. So it's about digging deeper to that root cause and practicing root cause medicine. And to really do that effectively and really personalize the treatments, we need data and we need to be able to inform our decision-making of how to help someone, whether that's through lifestyle or through supplementation or through medication or procedure. So when and how to test, one, you want to complete a thorough history, of course, conduct appropriate physical exam, and testing really should be utilized to confirm or rule out a diagnosis. Once you go through that initial visit, I would say you collect 80 to 85% of the information you need to know what's happening for a patient. We use labs to confirm that, to rule out those zebra diagnoses that are the high risk but rare that you want to rule out for a patient. You might also run them because you really want to personalize a recommendation. One great example of this is the use of nutrient testing to really understand what a patient's diet is doing for them today and what deficiencies they actually have inside their body. You might want to clearly understand the underlying cause of a disease state. I do this all the time for fertility. For example, if a woman has premature ovarian failure, I might be asking myself why and want to do testing on toxins or mold or inflammation or oxidative stress panels to try to figure out for that particular woman what might be happening. And also to assess risk. Of course, we use labs all the time to screen people and assess risk. And for us, I think that preventive standpoint is so important because then we can make changes for patients that can help them actually prevent disease using their lifestyle changes. And that's really what we're great at. One thing I recommend we keep in mind is with labs, you always want to think about what action will I take when these labs come back? Because labs, especially when patients are paying out of pocket for functional tests, they get very expensive very quickly. So if you're not clear going into ordering the test, how your treatment plan would change dependent upon the outcome, you probably should reconsider whether you need to run it. If you can't take a definitive action on that test or it won't make a difference, you have to ask yourself, is it really offering information that I need for this patient right now? So let's talk first about the conventional and functional lab testing. So conventional labs, what I'm talking about here is things like a CBC, a metabolic panel, a standard urinalysis. Now these are often run probably by many of you. medical doctors, nurse practitioners, and hospitals. And a lot of them are considered screening. So when you go in for your annual physical, you get a series of labs to really screen you and monitor your ongoing health. Now, functional and specialty labs, they really help you look at a function that kind of going a level deeper than the conventional testing. So for example, there's testing like organic acid testing, which might suggest that there could be nutrient deficiencies that would impact mitochondrial function. So what can be interesting about that is you utilize conventional labs, you might see disease risk for cardiovascular disease, for example, and knowing that mitochondrial function is so critical for a healthy heart, you might look at some functional tests to say, are there nutrient deficiencies that are putting this patient at a greater risk? Another example would be stool testing. While conventional medicine might do an O and P to look for ova and parasites and screen for an infection, a functional test, if that comes back clear, they might say, okay, you have IBS, and we'll talk a bit more about that particular example. Stool testing can actually look at more. It can look at a microbiome fingerprint. It can look at if there's inflammation. It can look at particular markers for hyperpermeability of the intestine. So there's so much more information that we can get. Now, you have to keep in mind, many of these may not be approved by the FDA. So the functional testing labs, they do need to get FDA approval for the physical lab test that they're doing, meaning that it's being done properly, they'll get consistent results, et cetera. But what's missing is the application of the results and data to a particular disease state. And while some functional tests that does exist and they are FDA approved, for some of them, they're not. So just keep that in mind. And a lot of them use a proprietary algorithm to digest the data that it receives from the test result and then create these really fancy PDF reports. And I'll show you what that looks like momentarily. But those reports, for me, really drive me to one lab versus another, because easy readability and interpretation is critical. And so it's not just a list of results. So when you look at a conventional test, this is a CBC on the right-hand side, you can see an example of the results. It's listed, it shows a normal range, and you can see that kind of basic information here. With a functional test, you're more apt to receive a little bit more information. It's a little bit more consumer friendly, and they can take really, I would say, like comprehensive biochemistry markers and turn them into basically what it means for you. Here's an example of a NutriVal from Genova, which is one of my favorite tests. And this actually is a great screening tool for me to better understand what underlying factors might be going on for a patient. So you can see on the cover page on the left, it actually summarizes at the top in red, yellow, and green, the kind of overview of what it's looking at for a patient. So you can see oxidative stress, mitochondrial function, omega balance, toxic exposures, and methylation imbalance. So, and you can see below that, they score it on a scale of 1 to 10 of the need for additional support in those areas. So what's great is when you're looking at this, you can very quickly see what underlying functional factors might be going on for a patient. In this case, my patient flagged for toxic exposure and high oxidative stress. This was a woman that she was in her early 40s trying to get pregnant, and she has poor egg quality. We're trying to figure out more of what's going on. And this provides me with a lot of feedback as far as what I should be doing therapeutically, what additional screening I might want to do for her, et cetera. You can see on the right-hand side, this is the same test, just a different page, but it actually shows you in that green, yellow, and red slider what her nutrient status is for a variety of nutrients. Some of these are direct measure, some of them are indirect. And then it gives a suggested supplementation of how much she might need to gain sufficiency on the right-hand side. So you get these really cool types of reports that come up here. Now, labs support precision medicine, and that's why I think they're so important and why I get so excited about the opportunity to engage further with labs. So this is a study that came out of the JAMA network that talked about patients' quality of life outcomes with the application of the functional medicine model. Really, it showed it really improves quality of life scores for patients when they engage with the functional medicine model. And it linked it to a couple of different things. One was the comprehensiveness of the model. Another one was that it really delivered precision medicine, which relied upon the ability to collect data, but not just collect data, to organize it into a framework that really helps with the understanding that that patient's biological processes and disease risks. And that's what labs can do for you and what a lot of these additional functional reports can do for you. Okay, so let's talk about labs in action during an office visit. So as far as labs go, like typically you might order these for a patient during a visit or after a visit. And when it's part of the workflow, you have to think about the time it takes for your staff person to complete order forms. You may need to be stocking kits in your office to hand to the patient. You have to have the materials necessary. For example, if it requires phlebotomy, you'd need to have blood drawing, stuff there if you didn't want to send the patient to an outside lab to draw. So with Wellevate Labs, you have a ton of labs to choose from in one platform, and you can order conventional and specialty products. You don't have to carry the kits. We handle all those logistics on the back end. And also we offer several different phlebotomy options that are available throughout the country to service your patients, from connecting you to a local draw center, connecting you with a mobile phlebotomy option where that person actually comes to the patient's selected address, like home or work, et cetera, or you can draw it in your own office. You also need to think about how you discuss the use of labs with patients. So, you might want to reference labs that have been done previously, talk about what you think you should be doing based upon what you know, and then why those labs are going to be essential for you to really be able to hone and focus in on their treatment plan. In my experience, it requires a lot of collaboration, especially when you're working with functional lab tests where there's an out-of-pocket cost. I am very frequently having conversations with patients about what my priorities would be. Like, I might say these 3 labs would be really helpful to collect the information we need to figure out what's going on. Here's what the estimated cost would be. And if we have to prioritize, here's the order that I think we should collect that information in. Because sometimes with lab testing, if you have 3 or 4 tests, you might be looking at over $1,000, and that patient may need to prioritize or collect that information over time. And if you do reach out to collect more information via labs, some practitioners will wait and not do a massive protocol until they receive those back. So your visit workflow, maybe first office visit is information collection. This is really the way I work it. Then based upon what I learn from that, I'll give recommendations for lifestyle changes. I might add some basics if they need it. So for me, it might be a preconception protocol with a prenatal and an omega and things that I know are just very foundational for them. And then when we receive the labs in, we can get more information about what's going on. And at that second visit, we review the labs and give a much more detailed, personalized treatment plan. So some of the potential challenges with labs, first of all, I've mentioned cost. So one thing that I recommend is that the prices for the labs that you're typically ordering so that you can talk about that with the patient, or your office staff can talk about that with the patient. Second is insurance coverage. So with labs, some labs, even in the functional space, they'll bill insurance and then they'll balance bill the patient if they don't get reimbursed or reimbursed fully. I don't know about you guys, but I've seen some challenges with conventional tests. For example, vitamin D, they only allow certain ICD-10 codes in order to validate or cover vitamin D testing. So when I've ordered it for patients kind of preventively, oftentimes the patient gets billed for that in the end because their insurance company rejects it because they don't have a disease state that requires it, like osteoporosis, for example. If the patient's fearful of blood draws, one nice thing about functional tests is there's so many more options: saliva, blood spot, which is just a finger stick, urine testing, et cetera. And another barrier may be a lab location local to you. And so one solution we really thought was essential was a mobile phlebotomy and kits that can be drop shipped so it actually goes straight to the patient. So typically when you order labs, I recommend that you get the patient scheduled in around the time that you expect them to be returned. That does a couple things. You can put a little bit more kind of pressure or impetus on the patient to get the test done quickly so that they don't receive a kit and then wait weeks and weeks on end because they haven't collected it. So you could, if you book a visit, you can say that gives you a week to do the test and then 2 weeks for them to process, and then we'll review. So there's a little bit of a timeline going there. I like to send my patients a copy of the results even prior to review. So I'll review them, I'll release them to my patient. They can get them through the portal, review them, and then come in with questions while we talk it through. And I would consider creating a template for the common labs that you use based upon what you're treating. If you're a generalist, this is a bit more complicated. If you're a specialist, it's a bit easier because you can describe the most common patterns you see and how you interpret that and what that means for the patient. but that walkthrough is unbelievably empowering for patients. Even things like a CBC or a comprehensive metabolic panel, I have had so many times where I've reviewed like a CMP with a patient, just simply explaining, these tests look at your liver function. This looks really great. These tests look at your kidney function. This looks really great. People they're not accustomed to receiving the information. And then when they spend all this money on lab testing, or all these labs get ordered, they know there's gold in there, but all they receive is like a note in the portal that says things look normal. Well, I think people really want to look at more than just nothing is out of whack. The other thing that, we're not going to talk a lot about today is that for many labs, the normal range is not necessarily the optimal range. We know this for glucose, for example. I don't have the exact data, but I think it's something like if you are if you are above 80 or 85 for a fasting blood sugar, every couple of points on that test directly correlates with a higher incidence of diabetes within the next 10 years, developing diabetes within the next 10 years. And that's all within the normal range, because remember, all we're looking at the normal range is like non-disease state, but we can determine risk and have those conversations with patients, that are deeper and more meaningful and get a lot more out of even the most basic labs compared to what they're accustomed to. Reviewing labs also is incredible for relationship building. It's a great way to get the conversation going around lifestyle changes, because it can be very inspiring when patients have something they can follow. And it also encourages compliance with your protocol. They know why they're doing it. They know there's a measurable marker. So that can be really helpful to get patients more motivated to do what you ask. So let's talk through a couple of case exams. So first one I'm going to talk to you about is a 31-year-old female who came in to see me with unexplained infertility. She'd been trying to conceive for 1 year. 31 is really young compared to many patients I work with. Her cycle was regular, but only 26 days. And she bled for about 5 days. Her obstetrician had said it's probably endometriosis. And the reason why is she had very heavy bleeding with clots, really severe debilitating cramping, cycle days 1 and 2. Her sister, she had a family history of endometriosis. Her sister had been diagnosed with it from laparoscopy. And then also she'd never had a laparoscopy, but her HSG, which is a hysterosalpingiogram, which looks at whether the fallopian tubes are patent, showed that one fallopian tube was blocked, and the OB said this is likely an endometrial implant. So she came in with this presumed diagnosis of endometriosis. She lived an extremely clean lifestyle, fantastic diet. She and her husband were athletes. We worked him up and he was within normal limits. So we wanted to try to get a better understanding, but going into that first visit, like I said, typically I start patients on a basic treatment plan. And then I kind of deepen it after I get lab results. So for this patient, the first thing we did was we ran those basic lab tests that I typically look at for fertility. So cycle day 3, estradiol, FSH, and AMH. These look for ovarian health and egg quality. And everything fell really well within the normal range, what would be expected for her. Her estradiol was a little bit elevated, was probably the only thing. Typically with estradiol, you want to see cycling women between about 30 and 50 on cycle day 3, and she was just above that, about 60. But given that she had that history that was suspicious of endometriosis, I thought, well, that's really in line because she does seem to have some estrogen dominance here. On cycle day 24, her progesterone was nearly 16, which is optimal. Thyroid looked good. Her testosterone looked okay. That looked quite good. Her DHEA looked quite good. And she had kind of a low normal hematocrit and hemoglobin was the only other thing we noted there. So her first plan we really presumed was similar to like an estrogen dominance type of picture with endometriosis. And so I focused on improving her estrogen metabolism, wanting to kind of help her liver process and conjugate and excrete estrogen to kind of normalize the estrogen. We worked on supporting egg health and really wanted to lengthen her menstrual cycles. 26 is a few too short days for many women to be able to conceive. And I put her on all the things, the DIM and all of those nutrients that can help with that. And she got worse. Okay, so she did not respond the way that I suspected. And so I said, okay, I think we need to dig a bit deeper. And we ordered some functional lab testing. In her case, I ordered what's called a cycle map, which is urine and saliva test that actually maps the hormones throughout the entire cycle. at 11 different time points. We did talk about doing this first off because it also looks at estrogen metabolism, but it was a cost issue. So we started with what was insurance covered. And when we didn't find we had enough information, we moved on to some functional testing. So this was the result of the urinary metabolites for estrogen and progesterone. So this is actually from a Dutch cycle maps with Precision Analytical. And you can see these dashed lines here, top and bottom, show the normal range. Estrogen is this top graph, progesterone is this bottom graph. So a couple of things I'd suspected, her cycle was 26 days. So I did expect she ovulated a little bit early and that her follicular phase would be a little short. And we saw that here. But I was very surprised to see that overall her progesterone level was quite low compared to the normal range, because when we measured it on cycle day, 7 days post ovulation, it was wonderful. But it actually was quite low throughout the second half of the cycle. And when we look at her estrogens, that's really remarkable. She was very low in estrogens, actually very surprising to me compared to what we'd expected based upon presumed diagnosis of endometriosis. But what's interesting is that when you look at this is actually plotting it against, like if they converted it to a serum equivalent. What we looked at was certain snapshots in the blood on specific days, because you can only get one day. And this was cycle day 3 estradiol, which you can see looks right within the normal range. Although every other time point for the most part is out of the normal range, right? And then similarly, when we look at serum progesterone, 7 days post ovulation, it looked really good. But nearly every other day, it was out of whack. So the snapshots that we took when we did that serum testing, one, they correlated, match with what we see on the functional test, which is great. We get some consistency in results, but it was really deceptive because the ones we measured looked okay in the blood and look okay here, but the rest of the cycle was really off. So this added so much value to what we were doing for her. The other thing this cycle map and Dutch test does is it looks at hormone metabolites. And so you can see here from a sex hormone perspective, overall, her estrogens were quite low. This is the normal range from star to star in green, and she was on the low normal end here. Okay. She did show, well, you can also see, last thing, that her cortisol pattern was quite irregular. This is a salivary cortisol measure. And while it was a little slow to rise in the morning, it should come down in the afternoon. And for her, it was spiking in the afternoon and evening. And overall, her 24-hour cortisol was quite high, which is a problem because that can disrupt other reproductive hormones. Now, when we look at the metabolism of hormones, I'm not going to get into this too much in depth for sake of time, but it looks at different markers along androgen breakdown pathways, progesterone, and estrogen. And so her estrogens, like I said, actually quite low. You can see the breakdown for estrone, estradiol, and estriol. And she does have a metabolic preference, we saw, to 4-hydroxy, this one, and 2-hydroxy estrone, which are the most common metabolic pathways in women with endometriosis. So she did have some of those kind of genetic SNPs that led her metabolism to be that way. She also was very inefficient with her methylation activity, converting 2-OH-E1 to 2-methoxy-E1 here. So you can see this is based upon the COMT pathway, it's the methylation, and her methylation activity was quite low. So we got a lot more information that we could take action on. So one of the things I'd had her on previously was DIM, because DIM, diindole methane, is one of the best things to help with estrogen breakdown. It helps to direct estrogen down the 2-OH pathway for phase 1 estrogen detoxification and away from the 4-OH, which tends to be more problematic. So that's a good thing. DIM was helping her with that. But the other thing DIM does is it lowers total estrogen in circulation. It helps with excretion. That was not a good thing for her. And I suspect that's probably why she got worse and not better, because we ended up lowering her estrogen, thinking it was elevated, when in fact she needs more estrogen support throughout the first half of that cycle. DIM also puts more stress on that methylation pathway, that COM2. That's not good because she has slow metabolism there already. So also my presumptive plan based upon serum testing actually stressed her system a bit more. But now we have so much more information on this. So we changed up her plan to focus more on COMT support and balance her estrogen metabolism. We use magnesium, zinc, trimethylglycine, SAMe, choline, and we supported her microbiome as well. So these things really helped her. And very quickly, she got much, much better. Her cycles started to lengthen by about 1 day per month. And about 3 months later, she picked up ovulation, which had moved out to day 14 instead of day 12. She had a 28-day cycle, and then she ended up conceiving. So we would have struggled with this because I would have been kind of banging my head against the wall as far as what was happening with her based just on serum testing. But that functional testing opened up a lot more information as to what was happening there. Okay, second case study. Let's talk a little bit about vitamin D. So this is a 63-year-old woman who presented to the clinic with a chief concern of kidney stones. She'd reported recurrent kidney stones, and she'd had high levels of vitamin D in the past. So she'd recently stopped taking vitamin D. Her previous practitioner had ordered a vitamin D test, and she was found to be deficient. So she'd been put on supplemental vitamin D at that point. They had no known cause of recurrent kidney stones, and the PCP had just ordered vitamin D once as a screen, probably at the patient's request, and never really repeated or done additional testing. So Dr. Nelson had repeated the vitamin D testing and then also ordered a broader panel, calcitonin, serum calcium, and PTH. So looking at that parathyroid function as well. So this is kind of the second piece of the lab picture, which is as a functional or integrative practitioner, one thing I think we really are very good at is not always following just the standard, but looking at what else would be relevant. Thyroid's another great example of this. While conventional medicine may say just order a TSH, when we have patients that come in and their stories don't really match up, we may order a broader panel that includes not just TSH, but free T3, free T4, reverse T3, thyroid antibodies, et cetera, to get a broader picture. So the vitamin D was found to be normal on the second test, really optimal at about 42. The calcitonin was normal, but her PTH was off the charts at 320, and her serum calcium was also out of range at 11.5. So she was referred for a sestamibi scan, and that revealed a parathyroid adenoma, which was able to be removed by a surgery. So this, again, this is kind of a zebra type of case, right? It's not super common. However, that broader panel of testing can be really advantageous for patients. I mean, this was missed by her PCP, diagnosed by her naturopathic physician. So I think there's a huge value for patients when they come into us because things aren't coming together, to think about utilizing labs to take a broader view and really try to dig a little deeper as to what's happening. Okay, third case I want to chat about is IBS. So IBS is great. Like, how do you test differential diagnoses? How do you screen out what might be actually happening? And how do you dig deeper when there are syndromes or symptoms that are happening without a super clear diagnosis? So this patient came in with a 1-year history of occasional diarrhea, primarily mostly diarrhea, occasionally constipation, floating stools, abdominal bloating, excessive gas, and they did feel that they were worse with certain foods like dairy and gluten. They'd been previously diagnosed with IBS from their PCP and was encouraged to try an OTC probiotic, Imodium just as needed for symptom management, and to try a low FODMAP diet. So the patient had done all those things and not really found relief. They also were taking a PPI from a previous episode of reflux, but not actively symptomatic, but they were still on the PPI. Now, I don't know about you, when I was in general practice, this could describe 50% of my patients. You know, diagnosed with IBS, given a couple of options, they either worked or didn't work, but they were oftentimes still struggling or working to manage it, really thinking that that was their normal without any kind of support to dig a little bit deeper. So this is a huge area for us as integrative clinicians to really make a mark and improve the lives for these patients. So what would you discuss via history? You'd be asking about colonoscopy and endoscopy. Do they have a family history of celiac? Have they been tested? Are there any warning signs you need to screen out, like unexplained weight loss, blood in the stool, watery stools? Do they have a history of food poisoning or traveler's diarrhea? I had one patient that I had treated, young woman who had just returned home from the Peace Corps, and she'd had like really bad diarrhea for a long time and had been tested for parasites. They hadn't found anything, and they were just kind of like, you know, sorry, you're fine. And a simple probiotic made it all go away for her. So travel, big one there. Recent use of antibiotics. Do they meet the diagnostic criteria for IBS? Have they had previous abdominal surgery? Any other known diagnoses that might be interfering? And then screening for alcohol and drug use. And there's a lot of things you'll be thinking about on your differential diagnosis for IBS type cases, and a lot of testing that you can do to help to rule these things out. So if you want to rule out exocrine pancreatic insufficiency, you could think about testing pancreatic elastase. IBD, you'd be wanting to look at calprotectin, look at fecal occult blood to see if there's any blood in the stool that you might want to refer out for colonoscopy. If you're thinking maybe SIBO, you could look at a lactulose breath test. If you want to screen for intestinal infection, malabsorption, maldigestion, or more, you could look at things like a stool panel. The stool panels in the functional world don't just look at O and P, although they're typically included in that. They're looking at the microbiome and the microorganisms that actually make for a healthy gut. They do screen for infection. They also look for signs of malabsorption. You could think about looking at organic acid testing to see if there's nutrient imbalances or the presence of yeast. And then if needed, you could think about things like screening for H. pylori. Okay, this is really important. I find H. pylori a lot, even in my fertility clients. I end up picking this up in a huge number of clients. Usually I'm doing stool testing, but breath testing is also available. If you have patients that experience symptoms of indigestion, really important to screen for H. pylori and also for C. diff. So some of the labs you might consider for GI, again, first, if you want to look at LabCorp, those kind of conventional standard labs, always looking at fecal occult blood, you might order calprotectin, pancreatic elastase, a GI infection panel, which again is not as complete and comprehensive as most of the functional labs, but you can get some basics there. And then you also could think about running things like tissue transglutaminase to look at celiac screening. Now, keep in mind the patient has to be eating gluten in order for those tests to come back positive. Now, some of the challenges for these, they have to collect separate samples for each test. The patient has to also go to the lab twice, one to go there and pick up the containers, and then a second time to drop off the sample. So it can be a little bit inconvenient. Now, the functional test is a lot available. Many companies, here's a couple of our favorites, offer functional lab tests that are stool analyses. And you may see things like fecal occult blood in there, calprotectin, pancreatic elastase, maybe a culture and PCR to give a microbiome snapshot, signs of dysbiosis or malabsorption, H. pylori. And you can also find a lot of tests that look at the SIBO through a lactulose breath test. So these get packaged and they're a single sample, so it can be a little bit easier sometimes for patients to collect that and be able to submit it. And then as far as moving forward, if the pancreatic elastase is low, they might benefit from pancreatic enzyme replacement and then further workup to understand why it might be low. If you see fecal occult blood or elevated calprotectin, they should probably be referred to a gastro for some imaging. If you've had a positive lactulose breath test, you'd prescribe the treatment based upon what gases are elevated, and probiotics can be chosen that don't contain prebiotics, which can aggravate SIBO. So there's a lot of great options available there. And if there's no concerning infections, and you've kind of ruled a lot of those things out, you might think about nutrient building type products like SBI Protect from Orthomolecular is a nice option there. It supports the intestinal lining and supports the immune function within the GI. If infection is present, many of the tests also do culture and sensitivity, not looking just at medications, but medications plus herbs. So things like garlic, berberine, Oregon grapefruit, some of the things that we love to use from integrative medicine get screened as potential supportive options there. And if celiac is positive, of course, you'd be formally telling that patient to go on a gluten-free diet. And if it's negative, they could consider further food sensitivity testing or think about just a food elimination diet and trial for a non-celiac gluten sensitivity. So you have so many options to provide more support for patients. So all in all, I hope you walk away from this feeling like the options for personalization are really at your fingertips. I think a lot of clinicians get challenged because it can feel overwhelming to have to learn what to use. And it can be overwhelming to put the systems into your practice to be able to use them efficiently with every patient. So that's really where we come in to really provide those solutions there. So within Wellevate Labs, there's a lot of different companies and tests available. Genova is very popular, offers a broad range of testing. I walked you through a couple pages of the Nutraval earlier. They also offer organic acid testing, SIBO testing, gut testing, evaluation, a wide variety of tests. Diagnostic Solutions Lab also has GI Map, which is extremely popular. This is a PCR technology that looks at mapping the microbiome, including parasites, bacteria, fungi, and more, looking for DNA for those organisms. So it's extremely sensitive. I also showed you Dutch Test by Precision Analytical. What they specialize in is a dried urine test for hormones. They look at hormone metabolites, and they have a lot of different hormonal tests available across reproductive and adrenal hormones. Spectracell is another great lab. They do a lot of micronutrient testing. This is really their kind of flagship product. It's great to confirm vitamin and mineral deficiencies. And also it really drives compliance for a protocol when the patients can see they have a deficiency and you're providing the supplementation of how to help with that. Doctors Data, another one that's been around a long time and really well respected. They provide heavy metal testing, and they do both provoked and unprovoked heavy metal testing, which can look at what's currently in the body for current exposures, as well as what might be stored in tissues from prior exposures. So a lot of options with Doctors Data that have environmental medicine applications. So it's a great one to look at. And then lastly, they offer, they've partnered with Labrix, which does salivary hormone panels. So another really nice option there. The FIT test, food inflammation test, I actually just ran this on myself last week to give it a try, and I've not used this before. But this is a food allergy or food sensitivity panel that looks at IgG, which is very common, but they pair it with actually looking at complement and different immune complexes together to try to make sure they're not putting false positives in there when it comes to food sensitivity. So a really nice company to look at. And then US Biotek is another very trusted company. They have a lot of different panels around allergens. I've used their food panels in my practice extensively. And also they have a lot of environmental allergens like mold, for example. Within Wellevate Labs, you have the opportunity to create a lot of custom panels. So if you're ordering similar testing, you can actually cluster them into a panel that you name that allows you to really select just one item from your menu, and it applies all of those labs. Okay, so it's available for the LabCorp test panels, and it makes it very easy. So if you want to have a wellness screen and maybe there's 40 different tests that you would include in that, you can build it once and save it, and then very easily make that order for patients. So it makes panels super, super easy if you're ordering a lot of labs. Now, without Wellevate Labs, if you wanted to run multiple labs for these companies, it can be a bit of a headache. You have to order direct, you have to stock the kits or manage the drop ships of different kits to the patients. With Wellevate Labs, you don't have to do that anymore. We make it so much easier. We were really here because we want to save your staff and save you all the time, all the money. And so we really make it as easy as possible. Like I said, we're not making money on this. We really just want to make it easier for you guys. So you can see a lot of the labs we work with here. And just wanted to give you kind of a quick demo. So let me try this video, and I have backup slides if for some reason this won't connect. Let's see how it goes.
Introducing Wellevate Labs, a better way to do labs, all in one place. Wellevate Labs streamlines your lab process, putting everything you need to manage patient care within a few simple clicks. It's a virtual hub where you can order, review, and share lab results, all from a single platform. With access to over 1,000 lab tests from the brands you know and trust, Wellevate Labs makes diagnostics easy, from choosing the labs you need to centralizing records and results. Wellevate Labs helps you organize your important diagnostic information. Accessing Wellevate Labs is simple. Just launch your lab's dashboard, and you'll be able to access better tools for better care. Order specialty and conventional labs. Securely view your orders and patient results. Access an expanded physician support network. Use the Ask the Doctor feature for support with labs and results. To place a new lab order for a patient, select Lab Orders. add a new patient, or select an existing patient. While on the patient details page, select Add New Lab Order. Here you can choose to order specialty labs or conventional labs with phlebotomy services. Let's start with a specialty lab. You can browse hundreds of options from multiple providers. Let's select the Dutch Plus test from Precision Analytical Products. Just add the lab to your cart and check out. When ordering specialty labs, you will be asked whether a kit should be shipped directly to the patient, or if you will provide it in office. In each option, the patient will be contacted to collect payment and complete the testing as required. Next, let's order a conventional lab and phlebotomy service. Select Conventional Labs under Type of Testing and select the phlebotomy type. Choose from mobile phlebotomy, draw center collection, or in-office collection. Next, you'll be prompted to select the tests requested. Click Add a Test to Order to view the list of available labs. Browse the list of available tests or search using the search bar in the upper right corner. To add a test to the patient's order, click the plus sign. If you see a test that you'll use often, you can add it to your favorites. Once the order is complete, click Preview Order to view your final order. Accept the terms and select Place Order. Patients will be notified by email that a new order has been placed for them. They'll be instructed to log in, complete payment, schedule their mobile phlebotomy appointment, and receive instructions to complete the testing. To view patient lab results, click Lab Results. You can search by first name, last name, specimen number, and collection date range. You can also quickly filter to display only results that you have not yet reviewed. To update other account information, click Edit Profile in the Tools box. Here, you can update your contact information and notification preferences, change your password, update billing preferences, and more. When you connect the access and support with the new Wellevate Labs, with everything your Wellevate platform already offers, it's easy to see how it helps you connect to better care. Take your practice and your patient care to the next level today with Wellevate Labs.
Excellent.
Introducing Wellevate Labs, a better way to do labs, all in one place. Wellevate Labs streamlines your lab process,
I think that
putting everything you need to make.
That kind of brings us there to the end. So I'd be very happy to take any questions that have come up. And hopefully you can sense my level of excitement with having labs at your fingertips in this way, in the same place that you're building treatment plans for patients. If you're not familiar with Wellevate, the main functionality of the portal is actually that you can shop from Emerson's full list of supplements, which is about 30,000 products, create a treatment plan with the product and the dosage, put all your handouts there, put a note in there, and the patient actually can receive it all through an app. They can get auto refill. They can really make it easy to manage your dispensary. And now with the addition of labs, and telehealth, which we have a free telehealth, telemedicine option, it really brings all of those tools at your fingertips to make practicing as easy as possible. So I'm happy to field any questions that have come up.
Sorry, I was trying to get to my mouse. Do you want me to read the questions or would you like to take them just in the chat?
So I opened up the chat. I can see your question, Michelle, around evidence-based for functional labs and how do you understand their significance, particularly in pediatrics? So that's a great question. And it's hard to generalize. Many functional labs have a very strong evidence base. Some of the things they do is they take very standardized testing and put it into a report that allows you to interpret with a greater level of detail. And so you really have to evaluate the test itself. And we've done that in the platform. There's labs that we don't include right now because we're not as assured of the validation of the product that they offer. So we really went through kind of that first pass there, but it is something that you have to look into to make sure it's relevant to your population. So your note, particularly around pediatrics, is really notable because the majority of these functional lab tests, they're not designed for children, they're designed around adults. So things like normal ranges are going to be set upon adults. So you may need to overlay the additional knowledge and expertise you have in pediatrics to narrow the expected results for that specific population. So it's a really great question. If there's any other questions, you can absolutely pop them in the chat and I'd be happy to address. Oh, there's a Q&A. I'm in the chat. There's a couple different.
Oh, there we go. Yeah, sorry. I thought you were
That's
in
all right.
I can also.
Okay.
Yeah.
So Yulia mentioned she does not see labs on her Wellevate. So that's because we're in soft launch right now. So we actually have rolled it out to certain customer sets, primarily physician customers. So MD, ND, DC, DO, you should have access to that. The rest of that group is actually going to get access early next week if all goes well. And that's because you'll actually have a different tool that will be available within your account called our Physician Support Network. So if you're a dietitian or a pharmacist or someone who may not have full ordering capability, but you're licensed, we actually have physicians across the country in every single state who'll co-sign on orders and really oversee. So all of those tests get screened by a physician to make sure that there's nothing that's red flag that needs to be addressed. But you can still get the access to them for your patients. So that functionality of that physician support network will be rolled out to the rest of our customer base next week. As I said, if all goes well, because everyone knows how technology goes, but that's the plan. And then Cheryl, you asked about how mobile phlebotomy works and what are the costs. So that's such a big question. So with phlebotomy, there's a couple options. If you draw in your office, you can collect the sample and send it in. There's no charge. If you choose a draw center, you'll be prompted to enter the address and it will provide you with a list of the closest LabCorp draw centers, and a $7 charge will be added to the order, which will cover the cost of the blood draw at the LabCorp draw center. If you choose mobile phlebotomy, again, you won't see anything, but when the patient receives the order, they'll input the information as far as where they want the blood to be drawn. So their home address, their work address, and they'll be prompted to schedule that as well. And there is a fee that gets added to the price for them, which it's between $120 and $150. So it's not insignificant, but for patients that want that convenience of someone coming to them, that is available to them. It takes about 13 or 14 networks of mobile phlebotomy countries for us to get full coverage in the United States. So it's not as easy, but we try to make it as easy and consistent as possible for the patient because that all gets streamlined within our platform. Okay, I think that is all of the questions that have come in.
Well, Jaclyn, this is really exciting. I just really appreciate all the work that you've put in to making this available, because I know that this has been a challenge for clinicians, especially in smaller practices, to be able to manage all of this and still provide really good options and care for their patients. So we're all looking forward to using it. And know that as an AIHM member, you can take advantage of getting a discount if you set up an account with Wellevate for the first time in Emerson. So please consider joining our membership.
Oh, there was one more question that came in. Do you want me to address that?
Oh, yes, of course, of course.
Whether there's a fee for non-physicians to order. So there is a fee for that physician co-signing, because of course the physicians get compensated for that time. So I think it's $10, don't quote me on it, but there is a small fee that gets added to each order that covers that physician managing that lab. So that is there, and it's based upon your account credentials. So when if you have a Wellevate account, you will automatically get access to labs. The first time you go, you'll be asked to provide a little bit more information, particularly your NPI number, which the lab needs and we don't have on file yet. So you'll be asked for a little bit more information, and based upon your NPI and your practitioner type, you'll then be assigned a physician co-signer. And then every lab that you order, you may not see it, but when it goes to the patient, there'll be an additional charge to the patient for that.
Great. All right. So if there's no other questions, I just want to again thank you, Jaclyn, and the Emerson and Wellevate team for all you're doing and for all the support you give our members and our community as well throughout the year.
I think we're
So
blessed to be involved with you guys, so thank you.
And do you guys see my screen? Do you see the PowerPoint?
Yes.
Okay, thank you. All right, so I just wanted to let you all know about what's upcoming, and we're really excited. Our partner, the Academic Collaborative of Integrative Health, will be having an integrative practice series, and this is just going to be a really amazing event with clinicians from around the country on exploring an innovative model for integrative pain management at a pediatric safety net hospital. So this will be on September 29th, 2021 at 9 a.m. Pacific time. So it is a different time for us, but we really hope that you come and join and hear about this really great hospital. And then I want to invite you all to our October annual conference. We have such a phenomenal lineup this year. There's over 50 speakers with 44.25 CMEs now. We just got our CMEs yesterday. And we really are just hoping to bring the global community together during this time that we're still all, in COVID and working through it all. We will be having an in-person conference in San Diego and a virtual conference. So please come and check it out, explore. There are limited spaces in person, so register soon. And we hope to see you in San Diego in October. Again, I mentioned the fellowship earlier. If you are interested in the fellowship, please reach out. We have a 1,000-hour, 2-year evidence-based curriculum fellowship for licensed providers that have a master's degree or higher, and that you can get a $1,500 off tuition for mentioning this ad and the wellness webinar that you watched if it's the first time you're coming to us. And please connect with us, connect with the Academy, consider becoming a member and supporting our efforts and joining the community. You can do that at aihm.org/join. We do provide all of our webinars for free to the larger community, not just our members, because we really value getting, educating everyone out there and providing access to all of the good information in integrative health and medicine. So you can connect with us on our youtube.com/AIHM Global channel, which all of our live webinars get posted thereafter. So if you want to come back and rewatch them or share them with family, friends, or patients, you're welcome to go to the YouTube website. And we can also be found under that same handle, AIHM Global, on Twitter, Facebook, LinkedIn, and Instagram. So again, thank you so much, Jaclyn. Thank you for being here. Thanks to Emerson, and we hope to see you on the 29th. Have a great weekend, everyone.